Isiolo, Kisumu, Machakos and Nyeri counties are the 4 counties that have been earmarked for the pilot program. Cabinet Secretary Health Cecily Kariuki, who was at hand to sign off on the MOU with the county heads, noted that it will be a challenging road ahead, but one that was worth travelling.
Today, as we sign the MOU with the 4 governors from Kisumu, Nyeri, Machakos and Isiolo, it is not lost on us, following the instructions given by His Excellency the President this morning, that it will be a rewarding but very stretching exercise, because we are learning, but also you don't quite experiment with health. We must be able to be available for the patients. We must be able to avail the commodities that they require in the facilities, in the pilot counties. We must be able to organize and work around our culture issues so that we actually are able to deliver. And I say we, effectively, it is the facilities being supervised by these governors. So we are aware that it's going to be stretching, it's going to be challenging, but it's also going to be exciting because, like has been indicated, we want to be part of the legacy program that helps in delivering healthcare to our people.
The element of cost.
The CS went on to note the support programs that will run concurrently with the pilot to ensure its success.
We have several interventions that will be running concurrently. One of the most critical one, which starts now, is awareness raising of how the program is going to be rolled out, which is going to be sustained until the launch date. We will also be registering the citizens in these 4 counties so that we can be able to then attach them to the facilities where they'll be able to access a service. We will also be discussing with the other stakeholders who will be in one way or another be involved in the actual implementation, and that will run on for the coming 1 month.
She also urged the other 43 counties not in the pilot phase to also set their house in order ahead of the program being scaled up countrywide.
Although we will have some intensive activity in the 4 counties, is for me to appeal to the governors in the 43 counties where we are not piloting to continue to ensure systems strengthening, to continue to ensure that we have the requisite HR capabilities in those counties, to ensure that we also continue to enroll those that are qualified for NHIF registration, and there will be parallel campaign going on there to draw the numbers.
Machakos County Governor Alfred Mutua, on his part, emphasized the importance of the program and his belief in UHC.
Today is a great day because we've started a journey that is going to give our people some of the fruits of independence that we've been talking about for 50 years. Provision of healthcare is key for development of any country and any society. And our people at times have to choose between feeding their children or going to hospital and getting treated. Now we are starting a process in this pilot study to show that it is possible for Kenya to provide universal healthcare to all our citizens.
I'll give you another one.
The governor of Kisumu, Professor Nyang' Nyong'o, reiterated the importance of measuring performance.
In other words, we must set for ourselves a time action plan to ensure that within a certain period we shall see whether what we set out to do we are going to do, and so Waziri Kariuki will elaborate on that. But also to make sure that we get specific outputs during that time period. That the output can be nothing other than access by our people to quality health care, which will stop families from being impoverished as a result of high cost of care.
With the pilot phase of the universal healthcare coverage officially a go, it is clear that health for all might just be a reality in our lifetime. We are hopeful that we will witness the program going to scale and attaining its goal. After all, a healthy nation is a working nation, and a working nation is a prosperous one.
Thank you so much.
Yes.